KPIs are key process indicators. So depending on what process you're trying to control or what process you're looking at, you always want to have some type of metrics to help you understand if you're within a variable range and if you're performing optimally the way you desire to perform as a department. There are different ways you can find what your averages should be. You can do literature research and see what average is for other institutions that are the same size as you, or you can base it off yourself, off your actual performance. You can go back and pull 2 or 3 years worth of data and say, this is during 2012, we were performing optimally and we saw 80 patients a day. So now that's our measure that we want to get to. Whatever you decide to do for your key process indicators, there's always the use that you could use a whiteboard in the area. Earlier I talked about physician practices. So in a physician practice, you want to keep a couple of indicators that'll kind of keep the team motivated. So if you want to say our goal is to get patients out of the clinic within 45 minutes every day, then you post those KPIs every day in an area that everybody can see it in the clinic, and that way you can continue to talk about it. So if you had a slow day or if you had a bad day, this is your area where you have the indicator there, and maybe once a week, maybe once a day, you all kind of huddle up and do a quick 15-minute huddle and say, okay, these are our indicators. This is how we performed this week. Why did we do so bad, or why did we do so great? What do we need to keep doing, and what do we need to change? But a visualization of whatever your process indicators are in a place that everybody can see them is a great way to make everybody accountable for those measures. If they're in an office with a manager who only pulls them out or only talks to the team about them when they're doing bad, that doesn't really help morale, and it doesn't help the ownership of it. It needs to be out, it needs to be visible, and it needs to be things that they can actively affect. It doesn't need to be things that they can't affect how many people call in. So that wouldn't be a key process indicator. A process indicator would be something along the way of your process that you can control. And we wanted to say Monday, Tuesday, and Wednesday. So let's say every 3 days we're checking those key KPIs. The manager's job would be to come in on Monday, come in on Tuesday, and come in on Wednesday, and make sure that the staff knew how they were performing. So normally this would be a report that's available, and most of the time you just print out the report. You would print out the report and you would post it. And so then we would have here, that would be your indicators. That would be how you performed. And then you would have this would be your goal. And so every day you can see how you're performing based off the goal. This could be time per patient. This could be, so let's think about a throughput. So when you think about a throughput project, what would you want to look at? So time for patient, that's what you would want to look at. You would want to look at patient wait time. So you would say, we would also have one of these next to it that says, how long did our patients wait in the lobby before we got them back? So then that would be a key process indicator. It's things along the step from the time the patient walks in the door to the time the patient checks out. There'll be certain areas that you will want to check in on. And some things could be the front desk. So the front desk person, this is your indicator. If you do this well, if we see this going up, that means you're doing your job. The next one might be for the nurses. So all the nurses, you know that patient rooming and how long does it take to do vitals, that's your indicator. So if this indicator goes bad, nurses, what do we have going on? Physicians, your indicator is patient wait time after the nurses have done their part. So everybody is responsible for each portion of the steps. So now we have a whole team. We don't have finger pointing. We don't have name blaming. Everybody is looking at everyone else's KPIs, and we're all trying to figure out how we make this better. Because if you work on yours, I work on mine, then the throughput of the entire patient, we resolve it.